3 seconds is all it takes to change a life forever. Most of the time, shaken baby syndrome occurs when adults, frustrated and angry with children, shake them violently. Shaken baby syndrome is child abuse. 1 in 4 shaken babies die. Others are left permanently disabled, mentally and physically.
There's nobody on the planet that has ever walked the planet that will be like her or had been like her. She is a unique human being, as unique as you can be.
Cynthia loved to smile. She loved to be held by everyone, and in fact, she was even brought to school, her sister's school, for show and tell, and she was a big hit in both classes.
Shaken baby syndrome is a form of child abuse, and it results when a baby is thrown, slammed, or violently shaken, and the results include damage to the brain, bleeding around the surface of the brain, bleeding in the backs of the eyes, the retinas of the eyes, and in some cases, rib or long bone fractures.
Cynthia was dropped off at 7:45 a.m. In the care of her certified child care provider. Actually, my wife's best friend. She had 5 children of her own. At that time, she was happy, healthy, and safe. And sometime in the early afternoon, they believe about 1:30, she was shaken. The child care provider then would call my wife and tell her to come straight home after work to pick up Cynthia. Arriving shortly after 6 p.m., she knew that there was something wrong with our child and rushed her to the hospital. And there were no signs of life, and they would try everything medically possible to revive her, but no more could be done, and she was pronounced dead at 6:59 p.m. on November 17th of 2000.
She was born happy and healthy on June 5th, 2005. She was shaken by her baby nurse when she was just 5 days old, broke 4 ribs, both collarbones, and caused a severe brain injury. She lost about 60% of her rear cortex and has been challenged ever since.
As seen in Daryl's and Patrick's situations, their daughters suffered because someone lost control. It's a story that happens too often. A babysitter, a child care provider, a parent becomes upset and usually without even thinking about what they are doing can cause devastating injuries, even death.
Shaken baby syndrome is most often an act of unthinking lashing out at a baby, especially when the baby has been crying a lot. Babies have heavy heads and weak neck muscles, so when a baby is shaken, the delicate brain moves back and forth inside the skull, causing serious brain injury. A baby's brain and the blood vessels connecting the skull to the brain are fragile and immature. When a baby is shaken, the brain bounces about the skull, causing the blood vessels to tear away and blood to pool inside the skull, causing permanent damage to the baby's brain. Shaking can cause brain injury, cerebral palsy, blindness, learning and behavior problems, seizures, paralysis, death.
It's vitally important for parents to talk with anyone who's going to be caring for their child about the effects of violent infant shaking and about shaken baby syndrome.
Besides crying, an adult may lash out at a baby because of problems they are having in their own lives, such as financial worries or a recent separation. Even a problem as seemingly simple as not getting enough sleep may push a person's stress level high enough to lose control.
There is no profile for someone that would shake a baby. We know that any adult could shake a baby in a moment of frustration and anger and change lives forever.
Recognizing and reporting abuse can help to prevent it from escalating to the point where the child is seriously injured or dies. Look for signs such as tired, limp, lazy, extreme irritability, decreased appetite, no smiling or making noises, difficulty swallowing, sucking, or breathing, unable to lift head, unable to focus or track with their eyes, different sized pupils, vomiting, difficulty staying awake. Talk to parents about learning to recognize stress before it becomes critical and giving themselves a timeout. If possible, they should call a family member or trusted friend to help so the parent can take a break. If no one else can help, the parent needs to know that it is okay to put the baby in a crib or playpen without blankets or pillows where the baby will be safe. It's just as important that caretakers and others who are around the baby understand the dangers of shaken baby syndrome. Encourage new parents to talk to caregivers about how to recognize the symptoms of dangerous stress and how to safely and appropriately respond to them. Parents should tell caregivers that if they feel their stress level is rising higher than they can handle, they should call a parent immediately.
For more information on caring for babies and young children, visit www.health.ny.gov or call 1-800-522-5006.